All right, so this presentation is talking about smile makeovers. When doing a new smile, we always have to think about beginning with the end in mind. So first of all, we need to figure out, are we talking white, straight, or perfect teeth? Or as my wife also likes to describe, Rob Lowe. Also, when we're dealing with a smile, we need to think about your budget. It's both time and money. I can't quote a fee without actually seeing x-rays, seeing your clinical description to be able to quote you a correct fee. However, I think it's important to understand kind of some ranges before we get started. Certainly would hate to have a $60,000 conversation if truly your budget is more $2,000 to $3,000. So I usually tell people a $2,000 to $5,000 budget is probably talking about doing like some teeth whitening, maybe a couple veneers or some bonding. A price range between $12,000 to $20,000 is probably going to be able to do porcelain veneers, a smile makeover. And upwards to $40,000 to $60,000 would be what we typically describe as a full mouth reconstruction. That's where we're fixing every single tooth in the mouth. So if you were thinking of something different, I think it's really important to have a price range and a budget in mind before you seek out some advice on a new smile. It can go up from there. If we were talking dental implants and much more extensive surgeries, it can be much more than just the $60,000. Now, whatever the goal is, we usually can find some sort of payment. We don't do payment in-office payment plans in our office, but we do work with some third-party finance companies. What they are able to do is allow you to fit the treatment that you're looking for in a budget, a monthly payment that is affordable for you. And I usually tell people a typical smile usually is going to be in the $200 to $300 range if you extend the payments out far enough. It's very similar to purchasing a car. It all comes down to what can you afford monthly. So whatever the goal is, the answer is yes. So the question also is, what is a veneer? A veneer simply, in the most simplest form, is if we cover the front and sides of the teeth, or in the picture it may even include the tip of the tooth. Now, quite often, because of other older dentistry or decay, we do go between the teeth. But unlike what the picture describes there. But it usually is a thin shell of porcelain that is bonded to the tooth, and if done correctly, is very, very durable. Here are some examples of some cases that we had done. We had done 10 veneers in this case. Person had gaps between the teeth. They had just finished braces and wanted longer teeth and filling in those spaces. They also wanted very, very white teeth, and so we were able to deliver that for them. Patient occasionally are given bad advice from other dentists. What the patient was told here, that the veneers in general last 3 to 6 years. So we did replace her older veneers that were chipping and breaking and quite a bit of decay around them, and we replaced those in just 2 visits. An old bridge that was what we describe as monochromatic, very unnatural looking in the color and shape of these teeth. So we replaced their bridge with a much more natural appearing. Not every dentist knows how to do veneers. In this case, was a case, veneers had been done, but they didn't really look like teeth. They didn't look the way the patient had desired. And so she opted to remake those veneers and do them in a much more bright white color. And in the case right here, we describe this as the emergence profile coming from the gum tissues have kind of a curvature this patient did not like, and so wanted that corrected. This is an example of a patient where years ago, growing up in their home country, the well water had caused the discoloration and weakening of the enamel. And so we gave a porcelain smile that was much more durable and aesthetic than what she's got right there. This old bridge that was replaced, we also veneered the adjacent teeth just to make everything match. And as you can see, that we can also have a very age-appropriate color. Teeth don't have to be extremely white to be restored. And this is an example of that. Case like this, patient was chipping and wearing down her teeth, causing some jaw problems. So by the time we fixed every single tooth in her mouth, we also had a side effect of a very beautiful smile. In this case, patient had some decay and some misaligned teeth, but was not willing to go through the orthodontic process and had chosen to do a veneer process, and again, chose a very natural color and not extremely white. This was a combination case where we also did orthodontics and lined the teeth up, removed some broken teeth, and did some bridge work. Crowns, veneers, and bridges to achieve this. Now, this did take a bit of time. This took upwards to, I believe, 3 to 4 years by the time it was all done. The amount of time that was invested was due to the orthodontic treatment. So we were able to go from a case like this and finish with a smile like that. This was an example of a patient who had GERD, gastric esophageal reflux disease. The acids from the stomach were eroding the teeth, and so we restored all of the teeth and protected them with the porcelain. And the result was also, the side effect was a beautiful smile. Old dentistry that had worn out, decay around some bonded fillings, some misalignment of her canines, the eye teeth there. And so we were able to tuck things in, make it have a lot more pleasing appearance there, and a much more natural white smile. Now, the nice thing about porcelain veneers is we can also close spaces and lengthen teeth. And an example of that was right here, which resulted also in a brand new smile at any age. She was certainly not as young as some of our other patients, but still was not too old to invest in her smile. So why does everyone want a brilliant smile? There's listed some options right there. Everybody has their own personal reason why they would want a new smile. And whatever the reason is correct. So I have some patients that will travel quite a distance. These are examples of an actress in LA or a beauty pageant contestant from Belgium had found their way to my office. I share these mostly just to let you know that the most fastidious and picky of my patients can have a great smile, and our protocols allow us to satisfy even the most picky people. I have an example here of a patient. She was a dress designer from Orange County, and she had elected for pictures. If you find pictures on my website of her smile, they certainly are a bit more white than perhaps many other people would choose. However, she's in Orange County, and most everything appears fake in Orange County. Sorry, those of you in Orange County. Also under the Klieg lights, as she's in pageants and such, on the catwalk, the super white smile does look appropriate for her. So the question is, how do we do it? How do we do it in just 2 visits? And I always tell people we start with the planning, the evaluation. Much like an architect building a home. The architect doesn't start pounding nails in wood and hope that they develop a beautiful result. They plan it out in advance. There's a carpenter's rule out there called measure twice, cut once, and that's the same thing that we do. We design the smile based on golden proportions or some numbers that are all throughout nature. Many times I had a textbook in biology that had this ratio that called the Fibonacci numbers, the phi matrix. And this ratio is all throughout nature in leaves and shells and our smile. We have 11 principles of smile design. So anybody designing a new smile will use these principles and plan out a case. The patients quite often aren't aware of the planning that we do as we design that smile. Much of this is communication between the dentist and the lab technician. So we're looking at the central incisors, the midline, axial inclinations of the teeth, arch form, smile arc, gingival height and symmetry, and the zenith placement of the gums. Contact points in embrasure form, gradation, buccal corridors, golden proportions, and the balance and symmetry. So the central incisors, we're going to look at each one of those individually. The central incisors, we look at the incisal edge position and the height to width ratio. We want the 2 front teeth are the dominant part of the smile. If we get the 2 front teeth to look fantastic, the rest of the case can be less than perfect and still have a great result. If we don't do the 2 front teeth very well and the rest of it is perfect, the entire case really does not come out very well. So, and this is an example here where a patient, she didn't really know why she didn't like her smile, but she was seeking advice on what to do. And it really was the height to width ratio. Once we had that corrected, she had a much more balanced smile. So we're trying to have the maxillary central incisors dominate both the size, shape, and position of the teeth. So we evaluate the facial midline. We look at what's called the high lip line as one smiles. We want to see how much gingival display that we have. Do we show a lot of gums tissue or do we show none at all? And so that's going to influence the way that we design a case as well. We look at the incisal edge in relation to that, and we want it parallel. We used to use the people's pupils as a way to determine parallelism or evenness. However, we have found, even in the example in this picture right here, the patient's eyes aren't exactly level. And so most of the time I actually use the horizon. I have them stand, and we look at the horizon as a reference point. So the midline cant. Now, this is a situation where if the cant isn't very good, then it detracts from the smile. If it's perfect, like the picture on the right where it's perpendicular, people may not look at your smile and say that it appears perpendicular. But if it is perpendicular, it does not detract from the appearance. Axial inclinations is another important aspect of a smile. We look at, again, when things aren't correct, they tend to stand out. And if we have good inclinations or more of a parallel look, then it doesn't detract. A smile arc is something where we want it to actually follow the lip contours. If they are flat straight across, as in the picture on the right or on the left, then they tend to look more like a denture. They tend to look fake. So now, gingival height and symmetry, if you have a lot of gingival display, a lot of gums are showing as you smile, then we want to make sure that we take in consideration the gum height. The highest point, or the zenith, is not right in the middle of the two front teeth. It's slightly off center, as in the picture on the right. However, the lateral incisors, the highest point, or the zenith, is right in the middle of the tooth. So it's important that many times I will use a laser to contour the gums to make sure everything is perfect. Now, in the smile, the picture here, the example shows when the zenith is off. So by using the laser, we can actually lengthen the teeth and make a much more natural appearance there. Now, the contact points in abrasure form, this is where the horizontal lines here, this is where floss would usually stop. And as you could push through, we want there to be somewhat of a gradation as things go back. So if you look right along here, the lines go up as they go backwards. And that is the way things naturally are. If they tend to be flat, straight across, again, we're going to mimic what a denture would look like. And that's not what people are desiring when they invest in their smile. The embrasure form, this is the empty space between, and it comes from where the contacts are. The upside down V tends to get bigger as it goes back. And so that's an important distinction in doing a good smile. Now, the buccal corridors, buccal is the cheek area. And today with Facebook, a lot of candid photos are showing these buccal corridors. A lot of candid photos are showing shadowing. And so by filling out those buccal corridors with the porcelain, we can actually give a much more full smile that doesn't detract. So the golden proportions, if you have a calculator out or you want to know what the numbers are, it's a 1.618. If you look at the central incisor compared to that lateral, it's a little more than 1.5 times bigger or wider than the lateral. And looking straight on, the canine is just a little bit close to half as wide. Now, if the person turns, the canine is actually bigger than the lateral, but from the vantage point of looking straight on, it's about half. So balance and symmetry gives us a very beautiful result. So the question is, where do we start? So we look at the height-width ratio, we evaluate the proportionality, and then plan it all out. I always tell patients we have informed consent forms where the patient is in charge all the way along. So we define the expectations before we begin, and we also try to define those limitations. Is it a budgetary thing? Is there a big event coming up soon? Will it prevent us? Do we not have enough time to do whatever it is that we are choosing to do? If there's a big event in a couple of weeks, braces is probably out, but veneers may be an option. So we try to figure the desired outcome, the budget, and the time frame. And those are important factors to know in advance when planning things out. So the investment, I usually tell people the investment is very similar to an investment for a car. And there are different types of cars. I think the McLaren shown here, I think we all would agree a McLaren is a very nice car. However, a Nissan Juke is a very nice car as well. And but the cost for each is going to be different. So are we talking 10 veneers versus teeth whitening and 2 veneers, if that fits in your budget better? Are we talking braces? So as you look around, shop around for a dentist, you may find that the fees are going to vary from office to office. Our fees are based on care, skill, and judgment. And I think it's fair to say that not all dentists have the same set of skills and judgment. But what we're not in our office, we're not Priceline. If you have $3,000 to spend, but your desire is something that costs $20,000, you're not going to get what costs $20,000, but we can probably find something that would achieve a goal with a $3,000 budget. So we can be creative with the treatment plan. We can do different, we can phase it over time or whatever we need to do to get you happy with your smile. So we have 4 basic steps, and then we added a 5th step. To choose the right number of teeth. As shown in the example, the picture here, 6 was not enough. So if you found a dentist that is suggesting 6 veneers as the ideal treatment, perhaps that's a sign that that person isn't very experienced with smile makeovers. We usually recommend that you do whatever shows when you smile and not just the 6 front teeth. If we get the good shade match, there's just some architectural issues that can limit the smile. Now, there's another thing that should be understood, and that's a property called metamerism. Things in different light situations are going to appear different. On more than one occasion, I have had different pantsuit that didn't match. And when I got dressed, it looked fine, but when I got outside, it didn't quite match, as the picture shows there. Really, we're talking the difference between incandescent light, fluorescent light, natural light, and just different light sources. I had a patient recently. She was a bit underwhelmed. So she had these two front teeth had veneers, and a lower tooth had a veneer on it. We had to orthodontically move the lower tooth. We bleached the teeth, and we did the two front teeth, the veneers, over again, with a very nice and satisfactory result, but it had its own limits. So step number one, we have a catalog of different smile designs. And in these examples here, the difference, these are all the same person, but different veneers. The canines might be a little pointed, the laterals might be the same length as the centrals, or maybe slightly shorter. There's different roundedness to the incisal edges or the tips of the teeth. And so we can mix and match and decide exactly what design is that you are desiring to have. And once we know that information, we can take impressions of your teeth and have stone models fabricated, and the lab can then wax up what we call a diagnostic wax up. It's a wax blueprint of the desired effects. The wax up is the key to the whole thing. So if you're seeing a dentist who suggests that perhaps a wax up is unnecessary, perhaps you need to keep looking. There are other methods that can do this without a wax up, but it's an in the mouth type of a mock-up. So there has to be some sort of mock-up prior to doing the treatment in order to achieve what the desired goal is. And then the step number 4 is to bond them all in place. What we do with that mock-up is we can actually take an impression of the desired effects. And so when the teeth are prepared for the veneers and we take an impression to send to the lab, we can actually fabricate a prototype for you to wear of your desired outcome. We let you road test it. Recently, we had a patient who we actually had made the wax up, and she came in to look at the case and said that the teeth looked too short. So we did it over again, made another wax up so that they were longer. When we made the prototype, they were made the prototype was the length of her second go round. And as she wore that for a few days, she came back to us and said that they were a bit too long. And so we were able to adjust that smile, adjust the prototype. And then once she was happy with the length, we were able to communicate that, to take photographs, impressions of those, and send that back to the lab. So she got exactly what she wanted. A sign that maybe you chose the wrong dentist is if the very first time you see your brand new smile is the day it's bonded in place permanently, then sometimes it's better to be lucky than good. So we can make the teeth longer, we can fill in spaces, we can change the color of the teeth, and go from there. So to start, we need diagnostic records. I need x-rays. I need photographs. I need to be able to plan things out. We require a clinical exam. So you can't just call me up and tell me what you want, then come on in and we start going. We do need to assess the situation, make sure the gums are healthy, make sure everything's clean. Our fee includes cleaning. We will clean the teeth and gums. We've had some people that had come to us within weeks of having their teeth cleaned at another office, and the other office appeared to have left a lot of tartar behind. So to be better safe than sorry, we just include a cleaning with our treatment. And then when we're all done, we also have another cleaning visit that we don't have no additional charge to make sure we clean everything up, to make sure everything is healthy. So we can take pictures of people's smiles and superimpose Phi matrix to see what is most appropriate. I hope this answered many of your questions. If not, feel free to send us an email shown in the description right underneath this video.